Hi everyone. Today's webinar is on shoulder pain, and I'm a chiropractor, Dr. Cary Yurkiw in Kelowna, British Columbia. And today we're going to be talking about different causes of shoulder pain. We'll be talking about things like tendonitis, arthritis, and then what chiropractic can do for those conditions, as well as what you can do to help yourself. So I hope you enjoy this webinar today. We should be about 10 to 15 minutes for this basic webinar. So thanks for joining me today. My name is Dr. Cary Yurkiw. I'm a chiropractor who's practiced for over 25 years, and I was helped by a chiropractor as a young teenager, which really changed my life and kind of set the course for my career decision. I grew up in Winnipeg, which is in Manitoba in Canada, and moved to the Okanagan, the Kelowna region in 2008. Initially, when I started practicing and graduated from chiropractic college in Toronto, I did locums. And locums is when you take over for a chiropractor when they go on holidays or they've been injured or they get sick. And that was a great experience because I had over 50 clinics as clients, and I worked over 100 weeks of locum work in the first 3 years of my career. So that gave me a really great exposure. It helped me to practice my practical skills that I learned in college and in clinic. So it really kind of accelerated my learning curve. And as a person, some of my hobbies, I love running. I'll be doing a half marathon this weekend, actually. I'm a writer. I've written 3 books. I'm working on my 4th now for Amazon, and we'll have it on our website. I do a lot of webinars like this, educating people about the basics of shoulder injuries, neck, whiplash, back injury, but also get into some more specifics. And we have some master classes coming up where we'll be talking more about what you can do, how you can take action to improve on these conditions. So please join us for the free webinars and the master classes. And just a disclaimer, consult your health professional about your specific condition. So each person and condition is unique, and it's best to work with the health professional, get a proper diagnosis, and then the appropriate treatment and the appropriate advice or recommendations. For shoulder injuries, we want to talk about the most common things that we see in the clinic. And so today we're going to talk about falls. And when people fall, they extend their arm out. And when they extend their arm, usually that affects the AC joint. And the AC joint is right on top of the shoulder, and that tends to get jammed. And sometimes it can even get separated. And so here's a picture on my screen of the AC joint where the clavicle at the top here comes into the acromion, and then there's ligaments in between the clavicle and acromion, and then below that on the coracoid process. So there's these ligaments holding things together, and when you fall with an outstretched arm, it's very easy to strain and stretch these ligaments and sometimes even tear them, causing a shoulder separation or AC joint separation. So that's something that we do see fairly often in the clinic where somebody's hurt their AC joint. The other thing that we see quite often is the rotator cuff tendonitis. And rotator cuff tendonitis is the 4 muscles that are on the back part of the shoulder, on the scapula, and the 4 muscles come together and then wrap around into the front. And in particular, the supraspinatus is the tendon that we focus on the most because this tendon kind of wraps around the front part, and what it does is it inserts right next to the biceps tendon. So we'll talk about that in a minute, but this can cause a tendonitis, and that's from imbalance of the musculature, the way the tendon is working in the joint, and then that ball and socket mechanism. So the other thing that I wanted to talk about is the biceps tendon. And here you have the 2 heads of the bicep. You have the long head of the bicep and the short head coming into the shoulder area and inserting very close to that supraspinatus tendon. So this can cause strain and sprain, especially if you've pulled on your biceps. Maybe you've done some work, or you're in the gym and you've done some exercise, and it's pulled on the tendon insertion on the bone. And sometimes we can see inflammation in that area, or even some tearing of the tendon away from the bone. So on the periosteum, the outer covering of the bone. So this is another common condition that we can see, we do see in the clinic. And then arthritis. Arthritis in the shoulder, and I'm talking about osteoarthritis, is when there's decreased joint space between the ball and the socket. So normally there's cartilage on top of the bone, there's fluid, synovial fluid in the joint, and then there's a capsule that surrounds everything. And so when you have imbalance in the shoulder and it's not working right over a long period of time, it starts to wear out certain structures faster than the others. So what we see is the cartilage getting broken down, and we can also see the joint space narrowed, and sometimes even some degeneration or breakdown of the bone. Sometimes on the x-ray like this one, we see sclerosis, or this whitening, meaning the bone's getting overused in that area. So we'll see some sclerotic margins on the x-ray. And we do have digital x-ray in the clinic, so it is something that we will do. We'll take those digital x-rays to look at the joint and see if there's any pathology, and if there's any damage, if there was an injury. So the skeletal system, it's composed of the spine and the joints, the accessory joints, and your posture. So when I think about this, I think about the alignment of the spine, and most people think chiropractic is about alignment, which it is. And I think about the posture of the body, the curvatures of the spine from the side, and then the attachments. So if the spine's crooked or the posture's poor, it can change the alignments of the shoulder or shoulders, because they're attached to the spine. So in particular, what we focus on is the neck area and the upper back, and then the ribs and the shoulder mechanism. There's rhomboid muscles here, and I'm going to show you that on the next slide, where the muscular system, like these rhomboids, attach from the scapula to the spine, and then from the scapula, the shoulder blade, then you have those four muscles that I showed you earlier, the rotator cuff going into the shoulder. So it's really important that we have proper posture and alignment. The macro picture is good, because if you have good alignment, good posture, you give the shoulder a better chance to heal, and you give the shoulder a better chance to function properly. The nervous system, it's composed of the brain and the spinal cord, and then the nerve roots. And sometimes what we'll see is interference to the nerve flow going from the neck into the shoulder. So this referral pattern can cause shoulder pain as well. So sometimes we have to treat the ball and socket, but we also have to make sure that we're treating the neck area and the nerves, the brachial nerves that go into the shoulder and down the arm, because they can tie into this condition, or even sometimes I've seen shoulder pain that's caused by a problem in the neck. So I think a proper diagnosis is really important, and then doing the proper treatment for it. So how can shoulder problems be fixed? I think number one, we want to find the cause of the shoulder problem. So we want to do a proper history, examination, and then diagnosis. And then what I'd recommend is you do see a chiropractor so that they can work with you on this condition, and then get some treatment for it. Three things to do when you do work with the chiropractor is restore the alignment and the function of the area, do stretches for the shoulder and the rotator cuff and the AC joint, depending on what the diagnosis is, balance the muscle function front to back, so not just the rotator cuff, but the pectoral muscles as well, and the deltoid. They're all very important, the biceps, in the function of the shoulder. And improve posture, because the better aligned your shoulder is, front to back, right to left, and up and down, and all those axes, the better the shoulder is going to work. Some things you can do if you have shoulder pain: don't reach overhead, because that really stresses the shoulder out, especially with any weight. So be careful. Even extending your arm outward with weight can cause re-injury of the shoulder. So while the shoulder's trying to heal, I wouldn't add any extra stress or strain to it. You don't want to be holding something and then trying to lift it away from the body. I would keep all the objects close to the body and lift with your legs and get some help. And then avoid sleeping on your shoulder too, because what I find is when patients sleep on their injured shoulder, it really causes pain and discomfort. It compresses the ball into the socket and it activates those nerves and damaged tissues, causing more pain. So people often wake up during the night with shoulder pain because they're sleeping on that shoulder. If you're in the Kelowna area, you'd like to make an appointment, you can call this number right here or click on the link in the bio or in the show notes, and you can easily book an appointment online. If you're interested, I did write a book on neck pain. It's on Amazon. It's also on our website. And it took me quite a while, like over a year, to write that book. And that was my second book. The first book was back pain. But in the neck pain book, I talk about things like whiplash and nerve referral into the shoulder, down the arm. And I talk about concussions and headaches. So that book is an ebook. It's in paperback and audiobook as well. So you might want to check that out. It's called Neck Pain on Amazon. We're located at the Landmark 4 in Kelowna, which is at 1628 Dixon. Easy to find, tall glass buildings. And today we're offering you $15 off your initial assessment. And this offers good for the next 7 days. So I'll put a link in the notes below. You can easily click on it. It'll take you right to the booking page, and you can book an appointment. Use the code 15OFF when you go to do that in the code line and coupon code line, and then you'll be able to get $15 off your initial assessment. The other thing is I'd recommend you follow us on social media, YouTube, and it's at Dr. Cary Yurkiw, because we're always posting these types of videos and recommendations. So follow us on social media. We're on TikTok, on Instagram, we're on Twitter, and we have a Facebook page as well. And then our podcast is called Super Healthy. It's on Android and Apple, so you can easily get that podcast. And usually you'll get the audio version of something like this, a webinar on the shoulder. So I want to thank you for joining me today. It was a pleasure talking to you about shoulder pain. We do see a lot of it in the clinic. And if you or somebody you know needs some help, you can always PM me, type in the chat here on YouTube, or you can always give me a call or message me at the phone number that I gave you on the previous slide. Okay, have a great day, you guys, and we will talk to you soon.